Hello, today I'm talking about facelift and neck lift scars, how to avoid terrible scars, how to get the very best scars when it comes to facelift surgery. When we talk about facelift scars, what do we want to cover with this? Well, we want to cover every aspect of scars. What's our overall goal? Well, we want really a virtually invisible scar. Secondly, what are the options that are available to close scars? And we all know about stitches, but there are other techniques that are sometimes used, staples, glue, so we're going to talk through those. What about the design of the scar? How important is that? In terms of the healing of scars, what are all the different types of healing that you can sometimes have? And we'll talk about those and what happens and why. Revision of scars, why can that be necessary and how is it done? What can be done to improve scar results? And then I'm going to show you a number of cases of my patients with different types of healing and results, and to give you an idea of what healing is. And then finally, my tips. My name is Dr. June Da Silva. I'm a facial cosmetic surgeon based in London in Harley Street, and I specialize in only the face, and I've been doing this for more than 10 years. And so I'm going to talk to you about my experience over these years. So what's our overall goal? Well, our goal has to be a virtually invisible scar. It's hidden in the natural creases in front of the ear. It doesn't change the hair. The hairline looks exactly as it did before. The scar doesn't change the shape of the ear. The ear looks the same as before. And behind the ear, the scar is discreet so that, particularly if you're a woman, you can wear your hair up, and the scar is discreet and difficult to see, if not virtually invisible. And these are two patients that came to see me for scar revision. They had surgery elsewhere. Well, we don't want a really wide, visible scar because it doesn't look natural, and we don't want changes in the hair, like steps in the hair, loss of hair. And we don't want the scar in front of the natural curves of the ear, because a straight line in front of your ear, well, it doesn't look natural. And the scar in front of this person's ear, this is called the tragus, well, it can be seen as a straight line rather than the scar being hidden around the natural curves. So we want scars that are discreet, difficult to see, they don't change the position of the hairs, they don't change the shape of the ears, and they're difficult to see. So what are our options when it comes to scars? Well, the first option is non-dissolvable stitches. And these stitches need to be removed, usually at about a week after the surgery. They cause very little irritation to your skin. So it's widely believed through scientific research that these give the best possible scars because they don't irritate the skin. I personally have deeper stitches beneath the skin that support healing, so when they're taken out in a week, there's no tension on the healing scar. The downside is they have to be removed, and if they're not removed, they will last for even years. The second option is dissolvable stitches. Now, these can be very fine white or even clear stitches, and putting those in the face, well, it could be described as a shortcut because those stitches, well, they don't need to be taken out. And for a certain proportion of people, they're going to be absolutely fine. The stitches will dissolve over 1, 2, sometimes 6 weeks. And as they dissolve, they just fall out. There's a small proportion of people who, when those stitches dissolve, they can irritate the skin and they can give an increased scar. And that's pretty much true for all over the face. We're looking at facelift surgery today, but it can be around eyelid surgery and blepharoplasty. And so what does that mean? Well, although overall it will heal well, sometimes there can be like slight track marks, or it can give rise to slightly wider scar. My personal feeling is to avoid these in areas that really can be seen to minimize these kind of changes. Thirdly, there's clips. Now, clips, what are they? Well, they're little metal tags, almost the shape of staples, that will hold the skin together. They used to be used particularly by surgeons in the hair, so particularly behind the ear, and sometimes patients who might have brow lift at the same time, they'll have like clips in the hair. Now, they are uncomfortable to take out, and there's a proportion of people who might get an increased scar because there might be a track mark. I personally don't use these at all. I'd rather use stitches that we either remove or take out, and that does take longer to do, but they are a little uncomfortable to remove, so I think it's fair that they give not quite the same aesthetic in terms of healing of scars as stitches. A fourth option is glue. Now there's two different types of glue. Now if you go to accidents and emergency and you had a tiny graze, sometimes a type of glue is used to close the skin, and that is a bit like super glue. It's made out of acrylate, and that cyanoacrylate, as it sets, it will just support the very, very superficial skin. So it's not really suitable for surgery because it doesn't do anything for the tissues just beneath the skin. There's another type of glue called tissue glue, and I previously, more than 10 years ago, did a randomized controlled study using this glue, and we used it in eyelid surgery without any stitches, and it worked very nicely in closing the skin. The disadvantages of this particular type of glue, this tissue glue, is that it's made from a human product. It cannot be made by regenerative medicine, and so that human product doesn't mean it's a blood product that is filtered. And so although it's screened and tested, well, potentially there's always a chance of unknowns, things like infections. So my preference is really not to use this tissue glue any longer, but there are some doctors who like to use it in facelift surgery because it can encourage clotting and reduce the risk of bleeding and hematoma. Certainly in my study looking at eyelid surgery, it can heal really well, but actually there was no difference compared to stitches. Stitches can work incredibly well in blepharoplasty surgery. What about hiding scars at all? Like endoscopic facelift surgery, ponytail facelift surgery? Well, in those specific techniques, I can hide the scars within your hair, which means the scars are invisible because they cannot be seen. They're only really suitable for mild degrees of aging. So if you have quite a significant amount of loose skin, which comes just with aging, it's unlikely the ponytail or endoscopic 3D facelift surgery is unlikely that's going to be suitable, because that loose skin is something we really need to address with facelift surgery. But for younger patients with minimal loose skin, this can be a really helpful technique because it avoids scars. Some of my colleagues use a technique called a hemostatic net, and that involves using multiple stitches in multiple areas around the skin and facelift surgery. Now, it certainly is not something for the faint-hearted, and it can look quite striking initially because there are these many stitches all around the face. And it's a technique that has been used to really avoid hematoma after facelift surgery. And hematoma is an issue where there's bleeding, a large bruise or collection of blood beneath the skin that can be small, half a golf ball. It can be the size of a golf ball. It can be the size much more significant than that. And so certainly certain doctors who use general anesthetic, where the chance of a hematoma can be as high as even 10%, well, some doctors are using this hemostatic net, and these stitches are taken out very soon after the surgery, but they're left there for several days. Personally, I do not use this technique because I'd be concerned about marks in the skin, track marks. Certainly in patients who don't heal perfectly with their skin type, ethnic patients, any patients with issues with scars, would have to be concerned that these little stitches may leave marks in the skin. However, that is a technique that is adopted by some of my colleagues. And the seventh option is really a combination, and that's certainly my preference. It depends on what each individual patient needs. I certainly prefer to use non-dissolvable stitches in parts of the face, in front of the ear, under the chin, because those areas we really want the scars to be as discreet or as close to being invisible as possible. Behind the ear, where it's more tricky to take out stitches, is more using the stitches that dissolve over several weeks can be an advantage. Tissue glue, well, there's some evidence that can reduce the risk of bleeding, however it's not largely used. And we talked about the use of endoscopes. Well, that can be particularly helpful where there's areas of gravity and descent around the tail of the eyebrow that can really be beneficial for some patients. Now, I do hope this information has been helpful for you, and if you have any questions for me, do not hesitate to contact me. Thank you for watching.